And today I would like to present the lessons learned from the battle against the COVID-19 in China. Since some of my colleagues also has been working in the front line of the epicenter. So I would like to invite another two of my colleagues to participate in this presentation. So my presentation are going to be three subjects. One is the general scenario, and the second one, what kind of lesson we learn. And third one, we did a small study on the transmission patterns and recovery from the COVID-19 in China. So I will present the first part, and my two colleagues will present another two parts. So goes to the first part, general scenario of the fighting against the COVID-19 in China. So all of you can see these figures. You can see the blue color is the local cases we reported since the end of the last year. And you will see the curve, and really it's fit well to the some infectious disease curve. And the red color is or you can say the second wave, which are imported cases after the started from beginning of the February. So up to the 28th of April, a total of 8,200 and 858 reported cases was reported, and more than 7,700 individuals was recovered from the treatment. And about 4,633 people was died of the COVID-19. So when you calculate the accrual case fertility rate, that was 5.6%. And you can see the curve reduced very quickly because of our strong intervention or containment countermeasure really effectively. So that's why the number of the cases is this new reported cases reduced every day. But the imported cases started from the beginning of February, and then later is here from the later of March. Most of cases are imported cases in red color, so you can see here. But in recently, we also find the asymptomatic infections. So totally about how many? So now we can see what's kind of our containment measures we did. So this combine those contain strategy, including the social mobilization and the personal protective measures with hand hygiene and masking wearing. Mask wearing, we thought this is very, very important, particularly when people gathering together. And if you wear the mask, it really help you for you protect yourself. Also, you protect your if you are patient, you will spread to the others. So and avoiding the gathering and keep the social distancing also very, very important. So all the because in the beginning of the outbreaks, it is in the Chinese New Year festival. So all the activities about the Chinese New Year activities stop. Even the hotel and even the restaurant, because everybody want to involve this battle and keep the social distance. And but for our medical doctor and our public health workers, we are working on the mainly full early. and one is early detection. Second one is early diagnosis. Third one is early isolation for the quarantine, and the fourth one is early treatment. And also for the epicenter in Wuhan, they locked down the city, so the movement restriction was happened almost for 3 months in the epicenter. But for the other cities around the country, only maybe around the 2 months. And particularly for the during the outbreaks for the hospital, we need focus a lot on the prevention and control of the nosocomial infection. This in the hospital, we have to do a lot of work on this. And also environmental measures, we are routine cleaning, and so some insecticides also be used in the surrounding environment. So these are containment measures. And if we would like to summarize these experiences we already learned from the battle against the COVID-19, I summarize here, and my colleague, Dr. Xiao-Nong, will give the more detail how many experiences or lessons we already learned. So basically, for the country, we divided into 4 lines. So first line, which means the front line of the battle, was the Wuhan epicenter, and surrounding the Wuhan, they call the Hubei province. Hubei province, they consist of more than 8 cities. And the second lines that was in Beijing. And Beijing, because in the later stage, there are a lot of imported cases due to the international flights. And the third line is the regions surrounding the Hubei, connect the Hubei province, those where they had more cases than other provinces. Then for other provinces, we call the fourth line, nationwide. And as I mentioned already, that so for early, so which is early detection, early reporting, and early isolation, and early treatment. Here, probably I majorly want to focus on the early isolation. In the Wuhan area as the epicenter of the outbreak, when so many people get the syndrome, they would like to go to the hospital. In the beginning, the hospital is full of the people. So, but the government quickly made the decision to build in the 2 big hospitals. Each hospital is more than 1,000 beds during the 10 days. So this can be help for those patients to be settled down in the hospital. Second one is we also build in the more than 10 quarantine hospital. Those quarantine hospital mainly to those has been detected as positive in the COVID-19, and those people has to be coming into the quarantine hospital, because if they still stay at home, the home cluster transmission still happen. So it's difficult to stop the transmission. So once the quarantine hospital was built, actually in the schedule in the school or those bigger area, so more than 10 quarantine hospital was built. So everybody, whenever you had a syndrome or you tested in PCR a positive person, they will be there. And then the 3C, particularly the community engagement, community health education, and communities involved in the hygiene and disinfection activity. So this is also very important. And in the whole country, and everybody involved in the help the Wuhan hospital and for the rescue of the patient. and also support to move some public goods like PPE and to supply to the Wuhan. So which need coordination, cooperation, and communication, and to put the logistic support to the epicenter. So actually, a totally 40,000 health worker, including the medical doctor, nurse, and public health work from each provinces to support the Wuhan and Hubei province. So all those people are really contributed and as a hero to save a lot of life there. So this is my first part presentation.
Thank you very much. I think thank you. It's my honor to join these meetings. It's a very important meetings. So first, as I mentioned by Dr. Zhou, there's several key experience we had in China. So let's move to some parts. I will give more details. First is lesson one is so all the infectious diseases control, we have at least, basically the principle is the same: early detection, early isolation, early report, and early treat. So first, we want to know some of the definition of the case. In China, we classed the case into the suspect case and confirmed cases. So of course, for the asymptomatic individuals and the contact is some of them is potential infectious resource, so we must take care. First, I want to mention the case definitions in China. Suspected cases to have to meet the two criteria. One is the epidemiologic histories. The second is the clinic symptom. So it's very important, but it's not confirmed because without the evidence of passaging, we cannot make these confirmed cases. So the move to the second part is suspect cases plus the passaging confirmed. We use the RT-PCR. If positive, we confirm. Or the viral gene sequence is highly homologous to know the virus is also confirmed. And the third is newly, if used the criteria for the IgM, specific, and IgG, detectable, or the specific IgG is reach the titles of at least 4-fold increasing during the convalescence compared with the acute phases. So for the second is not really reporting, but it's a very important issue is contact. How to trace and manage is very important. So for this contact searchings, multi-sector cooperation is very important, like public health securities, authorities, and the many departments should be involved to searching, to find the contacts. This contact is must within the several days, they contact the case, confirmed cases, or the suspect cases. How to find, how to tracing. So CDC, as you know, in China, CDC have played a very important role to respond for the investigation to find the close contact. It looks like the detectives, so should be carefully to find any clue to tracking, to tracing the contact. And the contacts under the quarantine, usually at home or at a designated place like a hotel for at least 14 days for the last contact with the case or the symptomatic individuals. So temperature and the symptom should be monitored twice a day. Usually outdoor activities not allowed. So this slide should mention we must pay much attention to prevention and control of the key settings and populations. As you know, healthcare facilities should be strictly implemented nosocomial infections, because it's any hospital inside infection should make a lot of troubles. So it's very important. And the second is it's essentials to implement effective disinfection of the place. The places where the COVID-19 patient or symptomatic infected stay there. So must be disinfections. And also it's essential to ensure the effective protection of the professional work in the epidemiologic investigations, isolate works, and medical observation site, environmental screening and disinfection, and specimen collection, and laboratory work, and transporting cases and infected persons or the suspected person. And as you know, the special care and management of the special population must be highly pay attention. In many countries, such cases happened in the prisoners' psychological side and the prison institution. And earlier treatment is, of course, is very important to reduce the risk of the death. Any case must take the good rest and support therapy like nutrition and oxygen support, supplies, and antiviral therapies, and also ECMO, CRT, and tocilizumab, convalescence plasma, and the traditional Chinese medicine, all be tried and be used. It's very effective in China, especially in Wuhan. A lot of cases have been saved. And of course, in the Wuhan, it's very special, it's locked down. But when everything is under control, so we need to know the transition stage. So how to make the risk assessment, it must be based on the risk of the strategy and the measures. Is adapt the local settings. At this stage, it's very key, still follows or adhere to the 4 earlier measures, and then like importation and control, the cross-border, and also the province, especially in the key and the big cities, and the prevention and of the local spreadings. It must be carefully watched, like the epidemic investigation, close contact tracing, and management must be conducted. And for fine-tune approach to balance the response and economic development is key issues. As you know, now the many countries, one hand is for the control of the COVID-19, but on the other hand, is released and for the resume of all the manufacturers. It's very important to make the good balance. And the lastly is utilize the high tech, such as the big data and the AI, artificial intelligence technique, to carry out targeted measure, like tracing of the travel histories, close contact, and transmission chains. So it keeps every crew to find any new case or any evidence to show the contact must be under quarantines. And also the timely risk-based precise strategy is very important. In China, we divided the whole areas into the 3 levels. One is the low risk levels. In these areas, strict prevent importation is the key issues, because in these areas, almost no confirmed cases, or no new confirmed cases was within the 14 consecutive days. The next is the middle risk areas. The strategy for this area is to prevent importation and block the local transmissions. As you know, in this area, it's not so much, not highly, the cases accumulated. So in these areas, we must be carefully block local transmissions and the prevention of the imported cases. And the lastly is the highly risk areas. In these areas like Wuhan, first issue is to block the local transmissions and prevent exportation of any cases. So any measures must strictly conduct. So risk, but anyway, the risk level is dynamic and adjustable. So when the resumes of the manufacturers, we must be carefully. As you know, it's not easy for the high risk go and return. So we invented the health code and the travel card. For the health code, we have used our mobile phone or the paper card to show the color. If the red colors means this person come from the highly risk areas. So must be get the more monitoring and the quarantine, the 14 days. If the yellow colors is from the middle levels of the risk areas, usually they be under quarantine for 7 days. If the yellow colors, if the green colors, it means it's come from the low risk areas, so it's keep it safe. But how to ensure the transportation risk infection? For example, if they travel to the other areas by the train, by airplane, or by the bus, we must be carefully to making sure that no reinfection. So we organize migrant workers to return to the work site in the very ordinary manners through the cross regions, like point-to-point labor corporations. So different provinces have to make the close collaboration to make sure these workers keep safe, no any infection risk. And then prevention and control of the guideline must be prepared in any enterprises. So protocol for health monitoring and reporting and management at the workplace and the living area, all the guideline must be prepared and to training to everybody to follow this protocol and follow the guideline to ensure the no potential reinfection occurred in the workplace. Next slide, please. This shows the control strategy for the imported cases. As you know, in China, now is almost no new cases, but we face the high challenges from the imported cases outside. So whole chains management from the border, from the port to the community to home, each chain must be carefully, strictly controlled. And like the entering, screening, 14 days history and health status reporting. So everybody, when they enter China, they must report within 14 days what they are traveling and what's the health status. And also, of course, temperatures must be monitored carefully. And 4 categories of the person, this must be strictly under control to not allow any potential infections to spread into the other side. And medical examination for suspected symptom and this must be by the inspection through the port and the transfers these cases to the, usually the suspect cases, the transfer to the designated hospital, and the close contact to the designated hotel for the quarantine currently. And the quarantine policy for travelers, usually 2 weeks quarantine in the designated hotel, depending on the risk evaluation and the local policy. As you know, in some of the areas, 7 days is enough, but some of the areas have this home policies, 14 days. So we are not we are equals, regardless of the travelers come from the domestic. They are also for the foreigners. We are also all the same policies. So it's some certain issues of lessons. It's my experience when I was in Henan, Sichuan, and some areas. I find some of the very good manners to ensure the prevention of the spreadings. It's better to centralize close contact for isolations. You know, in the many, at the early stage, we are most of the close contact be in the home, in the full isolation, but we find the cluster infection in the whole family. So we are concentrated to the one isolated for isolation, and transfer the severe cases to the provincial hospital or above for the good medical care, treat to save the life. As you know, in the provincial levels or the national levels have the very good condition for the medicine condition cares. And the preparedness for the preventing the outbreak or transmission inside the manufacturer must have very detailed preventive and emergency protocols. So each step must be strictly followed. And the triage site and outpatient specific for the patient's medical consultation must be set, which means separated from the other normal patient. Otherwise, it's a cross-infections occurred in some areas. And good epidemiological surveys is very important. So any investigators looks like detective find any crucial. So this is summary for my parts. The very key issues for the 8 items. One is this science-driven response, and the core traditional public health measures is should be, and the critical bottoms positioning and statement, and the community mobilization and response. This key is very important. We have the very good communities mobilization. So the community keeps their safe very strictly. So it's keep the outside importation. That's our very good styles. And the transparent public health communication, public communication, and the risk communication is very, very key to let the public know the potential risk. And international cooperation currently shows the most significant now. And the government leadership, coordination and cooperation also is very important. As you know, now China has the joint mechanism by the State Council to show a lot of the benefit to organize to any prevention and control. And the last is the logistic support. It's to support all the actions. So it's very important. Thank you.
To have such an opportunity to introduce our some modeling and prediction works. As you know, since the city lockdowns in Wuhan, our modeling teams start to work together to make some predictions for the future epidemic dynamics, and also we try to evaluate the possible impact and about the society's resumption, such as the school closure or go back to the workplaces. Now here, I would like to introduce some of our preliminary results. And this results and the methods and all of the details you can to follow this reference on the bottom of this screen. In this study, in our early study, we mainly focus on 3 key questions. The first, we want to know what's the risk and trends of disease transmissions in different regions, because you know in China, the cities, they all have their different characteristics. The second question, we focused on how to evaluate the effectiveness of the intervention strategies. The third one is we want to know what will be happens when the school resumptions go back, or the peoples go back to their workplaces, whether or not there will be the second outbreaks, or what, and also about the economic loss if this city lockdown continues. Okay, next slide. Okay, in order to do so, we have adopted age-specific disease modeling works. Here you can see we have divided the populations into 7 age groups. For each age groups, they have some special social characters, such as they are whether or not they are the school students, or whether or not they are working or stay at home or something. So, and also we have integrate 4 social settings. We believe that the disease transmission may occur in the social settings, such as their household, people are close contacts with each other in the household, and also the schools, including the colleges and universities. It's also a lot of people are gathered together. And it's a physical workplace and a public communities on public places. So in our model, we have, you can see age and social siting. Based on this model siting, we have utilized the demographical census data. By applying some computational methods, we can estimate the contact frequencies between different age groups, and also the contact frequencies among these age groups in different social settings. You can see some detailed mathematical descriptions in our paper. Okay, based on this methods, we have collected 6 cities, 6 typical cities in China, from the north to the south. These cities, we have their census data, and we calculate the contact frequencies among different age population groups. Then we utilize some parameters from the early studies of the COVID-19, such as their R0 value, their transmission rates, and so on and so forth. We can produce some predictions for the disease transmission dynamics. Okay, so in this slide, you can see if without any interventions, for example, if we have assumed the R0 to be the 2.5, without any interventions, the disease curve is a source into the sky. If we have utilized very strict social distancing methods, we can lower the curves for the newly reported cases. And also we have set up some intervention scenarios. Professor Zhou, next slide, please. We have set up some different scenarios. These scenarios is try to describe the disease intervention measures, such as the society's close-up, for how long, for 2 weeks, for a month, for 2 months, and also the resumptions for different scenarios, such as the school closure stopped first, then the workplace stopped first, and we want to see what will be happened for the disease dynamics. Okay, so in this picture, you can see we have set up many scenarios, and with our models, we can simulate whether or not if we resume the school closure or the city's lockdown, whether or not there will be the second outbreaks, and what's the peak, what's the intensities of this possible outbreak. And by doing so, we have compiled 6 cities Also, Wuhan is some special, very specific cities. For another 5 cities, it's the local imported cases cities, such as Hangzhou, Suzhou, and other cities. We can give some quantitative descriptions about the effectiveness of their. So due to the time limitation, I will not give some detailed description. You can see our papers published, and based on the last year's economic development data, we also try to give a predictions for the possible economic loss in each cities, and we can see if this intervention measures last for a month or 2 months, what kind of economic loss will be happens. Okay, so here is a very quick summation and some highlights about our results. Here we have 4 key implications for this study. The first implication is the main proper social distance measures is still essential, even when the school and business activities are resumed. Second, based on our model, we have identified the middle-aged peoples as the most important target for social distancing, because they are engaged in the schools, are engaged in their workplaces. They might be the hotspots for disease transmissions in different age group. So this middle-aged population should continue this social distancing methods. The third one is even within a country, such as in China, the social distancing measures should be adjusted dynamically to different cities, especially when these cities has different population structures. I mean the age or different type of working places and so on and so forth. The fourth one implication is we believe that this method is general method, which can also be used in China in different cities or locations, and also in different stage of the disease transmission. We also highly encouraged this method can be used in different countries, such as right now the countries are also in different stages. So here is a very quick and a brief introduction about our modeling and prediction works.